It seems like that every other person in Nagpur has become a victim of a flu again. Now this flu, which is called as H3N2, has been on a rise in the city. Maharashtra in the last 5 days has seen an 82% rise in this particular flu. The state is currently in an alarming situation. The health officials have been alarmed, the hospitals are kept ready. But what exactly is this flu? What are the symptoms? Should you be going to the doctor? Should you be taking the tests? And is actually Nagpur ready to handle this situation at this given point? Additional Commissioner Ram Joshi tells us more.
As far as medically we can see, H3N2 is a influenza. To tackle influenza, we are already have the laboratories, hospitals are also working on it. There are some types of the influenza, commonly known as H1N1, then H3N2, like this. So in January, we found 8 patients of H1N1. In February this year, we found 2 patients of H1N1, and in March till this 17th, we found 5 H3N2 patients, including 2 of H1N1. In both of our medical colleges, that is GMC and HMC, we have a laboratory for testing of this H3N2. Apart from government lab, 6 private labs are also there to give you the reports for it. It is called as Rivara Lab, Dhruva Lab, Lupin, Suishwas, etc. So to tackle H3N2, H3N2 is a when we focus on the H3N2, we'll see the say that the patient gets good temperature, higher temperature of the rank more than 38 degrees. It started coughing. It's a throat oriented and cough these things. Then body ache. These are the primary symptoms of H3N2. Basically, if we can concentrate at home also using mask, and then it will not spread. But once it becomes severe, then only we need to go for the test, because we have a limited test kits for this disease, and even medically also it is unless the patient is about to admit in the hospitals, we don't go for testing. Once we found such patient, we used to give them treatment, we used to give them medicines accordingly. All government hospitals are having the ample stock of medicines with us, and we are ready to we are ready for this facing. If the influenza of H3N2 spreads, we are ready for it. Basically, as far as all variants of influenza is concerned, we require to make our hands as clean as possible using soap. We should have a good diet of it, avoid smoking, then you should have sound sleep and rest also during this H3N2 or even other influenzas patients. You should avoid in mixing with the big gatherings, so that it should not get percolated to others also. If anybody in the city is having such type of the symptoms, they should approach to their respective doctors. Even the government hospitals are ready to tackle it. Thank you.